If you don't understand these 4 concepts, you're going to always struggle to keep up in nursing school. But once you finally do understand their importance after this video, then suddenly almost every single symptom you see in nursing school is finally going to make sense without having to memorize them. Here are the 4 boring fluid and electrolytes essentials that you think you know, but you don't. But stick with it, because I'm going to explain it to you like you're a 4th grader, not because you're stupid, but because it's just easier to understand that way. I'll teach you osmosis, diffusion, oncotic pressure, and hydrostatic pressure in a way you will never forget. And I'll give you examples that will stick in your brain like glue, so you know how to use these concepts to correctly answer your nursing exam questions. Because spoiler, even though they don't directly ask you about this on your tests, they expect you to know how to apply these ideas on your tests. Osmosis and diffusion are the 2 most important, and they're the 2 most likely to get mixed up. Osmosis requires 3 major players: water, a semi-permeable membrane, and stuff. Stuff is my 4th grade definition for anything that might be dissolved in the water or in some way influencing the water. It's the movement of water through a semi-permeable membrane, trying to dilute stuff as evenly as possible. Not only does understanding osmosis help in the kidneys, it also helps you understand the fluid shifts that occur with edema. So you can predict which disease processes will see edema as one of their symptoms. Because anytime you have a disease situation that causes more stuff to be outside the blood vessels than inside the blood vessels, that triggers osmosis, so water will leave the blood vessels and move into the interstitial space, because the blood vessels are a semi-permeable membrane.